Alright, team, listen up. We've got a patient with mastoiditis, appendicitis, and Dolfer's vasculitis. What's your diagnosis?
I think it could be appendicitis. The symptoms match up pretty closely.
I'm leaning towards mastoiditis. The pain seems to localize around the ear.
I'm not sure about those, but Golfer's vasculitis could be a possibility too.
No. It's prurigo pigmentosa. I'm sure of it. We need to perform a cystectomy immediately.
But that's risky. Are you sure that's the right course of treatment?
I don't give a damn about the risks. We'll save this patient. Trust me. Now let's get to work. Thank you for seeing me, Tracy. I need to discuss something important regarding my patient.
Of course. What's on your mind?
I believe my patient has prurigo pigmentosa, and I want to perform a cystectomy to help them.
Haas, are you sure about this? Prurigo pigmentosa is quite rare, and a cystectomy is a serious procedure.
I have years of experience, Tracy. I know what I'm doing. Trust me on this.
I understand that, Hawks. But we need to consider all options before proceeding with such a drastic measure.
I will not be questioned on my expertise, Tracy. This is the best course of action for my patient.
Hawks, I appreciate your dedication, but as your boss, it is my responsibility to ensure the well-being of all our patients. Let's discuss this further before making a final decision.
Fine, but know that I will do everything in my power to help my patient. I will not back down on this.
Oh no, the patient is in critical condition. I need to think of a way to break this news to Hawks. The cystectomy was not the right treatment for prurigo pigmentosa. How can I explain this to him without causing further distress?
What in the world were you thinking? You nearly killed our patient with the wrong cystectomy and misdiagnosis. This is unacceptable!
Hold on, we did our best with the information we had. We thought it was a case of cystic fibrosis.
I still believe it could have been a case of pancreatic cancer. We had valid reasons for our choices.
Actually, I had a strong feeling it was a rare case of parasitic infection. We were just trying to cover all bases.
Cover all bases. More like cover your incompetence. You're clueless, the lot of you. I can't believe I have such a bunch of bumbling fools as my diagnosticians.
We're not fools, Hawks. We tried our best under the circumstances. It's not like we wanted this to happen.
Yeah, we were just trying to do our jobs. We can't be right all the time.
I agree with Kelly.
Mistakes happen, but we learn from them and move on.
Learn from them. You better learn fast or there won't be a next time. You're on thin ice, all of you. I'll be overseeing every single diagnosis from now on.
Don't mess up again, or you're out, got it?
Storms out of the room. I can't believe I haven't figured out what's wrong with the patient yet.
Maybe you should try checking their blood work again or running more tests.
I've already done that, Johnson. It's not like I haven't thought of that.
Well, have you considered the possibility of a rare condition? Sometimes the most obvious answer is overlooked.
I appreciate the suggestions, but I think I know what the problem is now.
Really care to share?
I'll let you know once I confirm it.
Excuse me, Johnson, I have some work to do.
Wait, you can't just leave me here hanging. Hawks, where are you going?
I've got it. Prurigo pigmentosa was just a misdiagnosis. It's actually intracellular bacteria that we're dealing with here.
Hawks, what are you doing storming in here without the proper gear? This is an operating room.
Yeah, you can't just ignore protocol like that. It's dangerous for the patient and for us.
Hawks, you can't just make drastic changes like this without solid evidence. We need to follow the proper procedures.
Trust me on this one. I've seen the signs. It's intracellular bacteria causing all the symptoms. We need to act fast. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks.
If you had just listened to me in the first place, we wouldn't have had to go through all that.
But the wrong diagnosis nearly killed the patient, Hawks. You should have taken my concerns more seriously.
My concerns were valid, Tracy. You can't deny that.
We can't afford to make such mistakes, Hawks.
And we can't afford to ignore important clues, Tracy.
This argument isn't getting us anywhere. Let's focus on solving the case together.